We got it. So welcome, Lori. And I really want to thank Villages of Kensington for bringing Dr. Puchalski, Christina Puchalski, I know I'm going to botch your last name, to us. And I'm really looking forward to this presentation. But before we meet Dr. Puchalski, I'd love for you to share some words about Villages of Kensington and introduce her.
Well, I would like to first of all welcome all of you, though I can't see you, on behalf of Villages of Kensington, particularly since there are a number of board members here today, as well as our two co-founders, Suzanne Bowler and Donna Savage. So that's especially wonderful. So we are a small village. We're still growing, but this is very, very special for us. I've been actually promising to get Christina to come speak for quite some time. So this is kind of a culmination. But in any case, my first encounter with the geriatrics division dates back about 25 years. So I turned there for the care of my mother. And I found there an actual well of amazing knowledge and compassion. And I also discovered Christina. And as many of you already know, she's a gem. She's someone who holds audiences transfixed. She's someone who has changed the healthcare landscape regarding spirituality. And she is someone that I am proud and humbled and absolutely delighted to introduce and to present to us today. So let's welcome Christina Puchalski.
Thank you very much, Lori and Steve. I really appreciate, Steve, all your technical support. And I want to do a very big special thanks to Lori Pross, a dear friend who is an amazing person who just her primary aim in life is to help others and be present to others. And she's just this shining example of what, in part, we're going to talk about today. So thank you very much, Lori.
Great. And before you begin, Dr. Puchalski, what Lori and I will duck behind the curtain, but I want to remind the audience that if you click that Q&A button, if you've got a question or comment, and you can use that Q&A button, and then we will make sure that Dr. Puchalski gets those questions, and we try to address as many as we possibly can. So really looking forward to this. Again, thanks to both of you, and I'm going to duck behind the curtain. And Lori, any final closing words before we let the good doctor get started?
Not at all. Let's just go for it. I want to hear what Christina has to say.
Great.
Thanks, Lori. And I can't see all the faces, but it's really an honor to be with many of you. I've been looking in the chat box, and some of you I know very well, and I'm just delighted we can spend some time together. So today I'm going to talk about spiritual health, an essential element of health and well-being, and I'm going to start by giving a little overview of the George Washington Institute for Spirituality and Health, which I founded 20 years ago. We're actually celebrating our 20th anniversary this year. So for those of you that are signed up on our list, we are going to be doing some sort of celebration. We'd love it to be in person, but it may be Zoom, but whatever the year holds, that's what we're going to do. So what does our institute do? Our mission and vision, we're trying to integrate spirituality and spiritual health into healthcare for all patients and their families through research, medical school, clinical initiatives, professional development, and global health policy. And our vision is really about an innovative model of global health that recognizes spiritual care as a fundamental part of treating the whole person. You know, we hear body, mind, and spirit a lot, but I think many of our health systems, not just US, but globally, still focus primarily on the body, maybe a little bit on the mind, but we're trying to gain that attention to this spiritual domain. And that website, which maybe Steve, you can put in the chat box, is if you're interested, you can go to that website, which is actually new. We just recently updated our website. So what is our work about? I think of it as bridging the divide. If we think back to the founder of hospice and palliative medicine, Dr. Cecily Saunders, she actually coined the term total pain back in the 1980s. And that included physical, emotional, social, and spiritual pain. So she'd been writing about it for a long time. And yet as the field has developed, again, as I just sort of alluded to, a lot of the development has been around focused a lot on the physical pain aspect and a little bit less so on the other three. Also, more recently, whole person care has become a model or a focus in healthcare in many countries, including ours. And again, the biopsychosocial spiritual model, or the physical, psychological, social, and spiritual model that Dr. Saunders described for palliative care is often seen also as one for whole health, for the whole person care. So our work is, while we often have worked within palliative care, I'm an internist, geriatrician, and palliative care doctor, it is applicable to health across all ages. One of the many things we've done is to work with WHO, and recently, well, 2014, they began the passage of the palliative care resolution. And while WHO doesn't have the word spiritual in any of its documents, in this document it does, which was a real success to be able to get attention to spiritual dimension of health. And in my presentation in a few slides, I'm going to discuss some work being done by a colleague to try to change the basic definition of health to include spiritual health. Now, if we just look at history, for centuries, spiritual leaders, shamans, religious leaders, and others, healers, have been involved with healing practices and healthcare, as you might consider it, or in the care of people who are dealing with illness. But around the turn of last century, there was a separation of that element from healthcare, largely by medical school education guidelines. And that, of course, has changed. But it's changed more in recent years. And then in terms of formal spiritual care professionals, so those are chaplains. And a lot of people don't quite yet know the richness of chaplaincy, but just to kind of a sidebar here is that chaplains are not just clergy. This is not just about religious care. There are secular humanist chaplains, there are religious chaplains, but all are trained to attend not to their own needs or their own view of spirituality, but that of the person they're caring for. So they're an incredible profession, and it's such an honor for me to work with chaplains and do interdisciplinary work with them. And so there have been formal chaplaincy since the early part of last century. And yet that divide between clinical care and professional spiritual care and spiritual care, while narrowing, is still there. And that is our work, to bridge that divide by creating clinical models and ways to address not just spiritual distress, but also spiritual health. And recently, a colleague of mine had been talking, Catherine Pettis, had been on Facebook talking about the need to operationalize compassionate care and the importance of compassionate care, being present, of bringing in that loving dimension into healthcare and demonstrating that actually there are better healthcare outcomes. And we feel strongly at GWish, and many of my colleagues that I work with around the country and in other parts of the world, that spiritual care is the way to operationalize compassionate care. So by developing these models, by integrating them fully, we are hoping that we are seeing those that are trained by us and others more compassionate in their encounter with their patients and really advocating for compassionate, spiritually centered care. So just by way of background, we started an elective in 1992. I believe it was the first elective in spirituality more broadly defined. There were courses prior to that in religious medical schools that had more to do with ethics and the tradition of that school. But we tried to do this elective as a broadly based elective. And then it was successful, and I had a chance to meet Lori's husband, Dr. Jim Blatt, who's a professor at GW. And I credit him largely with a long partnership in developing education curricula around spirituality and health. So we did that through 1998 and through 2008 and continued to do that. We ran an awards program that was funded through Templeton Foundation. We developed a tool called FICA Spiritual History Tool. We started retreats in Assisi, Italy for healthcare professionals and others. We started doing some demonstration projects. Moving into '09 was a critical time in our history in that we started working nationally with colleagues such as Dr. Betty Farrell, a very well-known nurse researcher and globally known advocate for palliative care in nursing. And we worked on improving the spiritual domain of palliative care, a consensus conference that was funded by the Archstone Foundation that launched the work up to the current time. We launched our Summer Institute that now has been supplanted with the ISPEC course that I'll talk about in a minute. We then did in 2010 through 2012, we did international conferences on improving the spiritual domain of whole person care. And that's where the definition that I will show shortly that Lori alluded to was developed. We launched a clinic at the support of a palliative care clinic at the Medical Faculty Associates at GW. We started reflection rounds with Jim Blatt, a program for professional development for students. And we're now working at a clinician and resident level as well, just moving into that. In 2013 to 2015, we continued reflection rounds. We started piloting some spiritual care training and a global network was formed. And then more recently, we've been working on ISPEC, which is a online and a train the trainer program in interprofessional spiritual care, where we invite clinicians and chaplains from different sites or within the US and around the world to learn about spiritual care, how they can practice it, how they can go back and teach their colleagues and begin to do some demonstration projects around spiritual care models. So a lot of exciting work, and we're doing more collaborations now internally as well at GW, especially with our new dean, Dr. Barbara Bass. So here's our definition of spirituality. And what's critical about this definition is that it is not just focused around religion. In the early years when I started this work and Dr. Blatt joined, a lot of the concerns was that this was just about religion and what is the place of only religion within healthcare settings. And through a lot of our work and the work of others, and this was the definition from the consensus conferences, there was an agreement that it's about how people that we work with and care for and ourselves, how we understand spirituality in our lives. And while it may be religion, it could be something within secular humanism, it could be something very personal, philosophical, something hard to put words on, but it is how the person understands it. So it's dynamic, it's intrinsic, it changes throughout all of life. I'll talk a little bit about spiritual development later in the talk. It's how we seek ultimate meaning, purpose, and transcendence. So that sense of ultimate meaning is what carries us through to the end of our lives, that sense of meaning throughout all our lives, not just in one particular time frame, but meaning, purpose, connectedness, and transcendence is key. How we experience relationship to a wide variety of things. Might be ourselves, our inner self, our family, others, community, society, nature, and the significant or sacred, however people understand that. And that it can be expressed through beliefs, values, traditions, and practices. Again, what is important to the person. We also think that spiritual care, and especially in this year and last year in particular, the tragedy in this country and in other places about the lack of respect of people who are different than us, of each other. Spiritual care is at the core of respectful care. That is what is so inherent about spiritual care. And that's why it's a way to operationalize compassionate care. By understanding what gives a patient meaning, purpose, and hope, providers can play a critical role in relieving suffering for the people and families in their care. And one of our board members, Trace Haythorne, who is a chaplain and the executive director of the Association for Clinical Pastoral Education. He's a board member, and his organization and Trace are partners in many of our projects, including ISPEC. He said, in these times, I wish we could change patient to citizen. So how is it that we can treat each other with that kind of respect and dignity, regardless of the similarities or differences that we encounter with other people? We've accomplished a lot of things in the last 20 years. I've mentioned curricula, the FICA tool, a spiritual history tool is widely used. Reflection rounds is a comprehensive reflection, part of personal and professional development. And I mentioned ISPEC. I bolded those because part of the rest of my talk will be focused around some of the work based in reflection rounds and interprofessional spiritual education and care. So our overall program areas are research and transforming practice through that ISPEC program and the spiritual history tool. And then a big section on practitioner well-being and support, and we're moving into also looking at developing a section on the website, not just around practitioners, but also patients and people that we serve, all of us. And then collaboration for change is our education initiatives and the global network. So I want to start, this is not my patient, but in my own personal experience with patients in my life, what inspired me actually to do this work before, I mean, after the elective got started, but before GWish was founded, was a patient that I cared for at Community Hospice, which is no longer in existence, but was a wonderful hospice. And it was a woman who was dying of, I believe, pancreatic cancer at the time. I visited her, and on my first visit with her, I did the standard history and then asked a spiritual history. And we'll talk a little bit about that for ourselves. But in the spiritual history, I asked if she was spiritual, and she says, not really, not particularly. And I asked what gave her meaning. And I remember her kind of looking off to the side as this Google image I found. I don't know, nothing really. And so the next time that I came back to visit her, she was really excited, looking directly at me, not away, and saying, you know, I've been thinking about that meaning question. And actually, there are a lot of things that have given me meaning in my life. And she proceeded to give me her sort of life story through the lens of meaning in her life, and profoundly spiritual, profoundly deep, and something that really helped her at this particular phase in her life. She died, I think, a few weeks later, to start honing in on that meaning at that moment in her final days. So I realized from her how important this was. And I often quote this story because at the end she said, I have this feeling that you're going to be teaching medical students, so please share the story with them. And it's my way of remembering her, but it's my way of bringing up how important this is and how relevant this is to all of our lives, my own included. So what can trigger spiritual questioning and reflection? Well, certainly illness can, stress, all the life events that we've experienced, 9/11, the pandemic, wars in many of our lives. Certainly in my parents' lives, war was a huge defining piece of who they were. Loss, grief, the uncertainty, whether it's internal or external, as we're probably all experiencing both of that right now. Isolation, facing mortality. There's many, many things that can trigger that questioning. It's a tough questioning because if it also triggers some level of spiritual distress, it's often hard to put words on it. So it's hard to share that with someone. Hence a lot of our work on how do we listen to those existential spiritual questions of the people that we serve, of our family, of each other. So this concept of spiritual health, I think, is really an important one. And it's a term that our dean has been using to describe this work. And I think while a lot of my work has been in addressing distress and how can we help alleviate that, that's often the way physicians think in terms of assessment and diagnosis, there's also how do we support spiritual health? So there's many definitions of that. This was just from Google, and many people talk about health as that path to inner peace, regardless of the turmoil around us. So how do we find that right now? This is an interesting time for spiritual care, actually, as well as for everything else. But one thing that has happened is because I think of the pandemic, more and more people are recognizing what spiritual and existential distress is because we're experiencing it. My patients are, their families are, we are, my friends are, my colleagues are, people in my condo, you know, what's going to happen next? What's the future going to be like? I think it's a time when there's this increased recognition of this domain because we're all really experiencing it. But at the same time, if we think of our own lives, or those of you that are clinicians, of the patients and the families that we serve, their illness, their stress, all those things that I just showed on the previous slide, that triggers also deep distress that now the rest of us in the world are perhaps experiencing maybe for the first time. And then in the bottom image, people talk about gratitude, kindness, intention, balance, unconditional love, peace, wisdom, healing, release, harmony, ask. So many, many ways that we, all of us on this call, can define for ourselves what spiritual health is. What I'm sharing is just some things to perhaps reflect on, but how you understand that for yourself is going to be part of your understanding or your takeaway from this, I hope. Now, getting back to the definition of health. So the WHO still has its 1948 definition of health, which is a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. Though it's obviously a dated definition. And some of my colleagues in Europe started in 2004 and continue to advocate for a broader definition of health, which aligns with a lot of the work that I'm going to talk about, a lot of the work that we're doing. So think about the fact that people are living much longer than they were in 1948, and many people have disabilities or illnesses or diseases, and yet would consider themselves healthy. I have many patients who tell me that they're very healthy. So just because anybody's on medications doesn't mean they're not healthy. And that is the point of Huebner's work, that we need to update this definition of health to mirror what's happening in our world with aging communities who are doing very well, many who are doing very well. So health is the ability to adapt and to self-manage. It recognizes each person's ability to cope with chronic illness and be healthy, even in the presence of ongoing chronic illness or conditions. Ability to perform relative to the condition. The spiritual domain that she refers to is the achieving individual fulfillment, meaning, and purpose. So there again, that notion of meaning and purpose in life comes up. And then negotiate the demands of our social environment. So she did a number of focus groups, and at first did not have the spiritual domain in, but after the focus groups of patients, family, caregivers, clinicians, and others, researchers as well, these were the domains of whole health: physical, emotional, social, spiritual, or existential, and then others such as financial and intellectual. And that mirrors the definition that we use in our medical school now from the School of Public Health in terms of what is whole health or wellness. And then components of the spiritual wellness might be any of these. And I think if we had time and I were to ask all of you to text in the chat, what is spiritual wellness for you? This list would be huge. But some of the big categories are, again, achieving individual fulfillment, meaning, purpose, our relationship to what we consider transcendent. And I'll give you a really nice definition of transcendence. That's a tough word for some people, but what is outside of ourselves, bigger than ourselves, in sort of short. Nature, God for some people, the universe for others, different ways that people see the other in their life. Sense of peace, the sense of awe and wonder, connection to a spiritual community, desire to give and receive love, capacity for gratefulness, ability to forgive ourselves or others, sense of hope, time for mindfulness, solitude, and spiritual practice. So those are some aspects of spiritual wellness. So the biopsychosocial spiritual model that I mentioned, that Cecily Saunders was one of the first to describe, usually has been seen in terms of identifying distress, because that's, again, how we've looked at things within palliative care and other care. But I flipped this for the presentation to look at sort of the biological. So if we have pain, it's managed. If we can function physically, we manage whatever our chronic illnesses are. It's not that we have everything normal in our lives and we're fully functional and there's no illness, no medication, that we're able to manage this and live physically in spite of or with whatever our disabilities may be. And then psychological, the same thing, a healthy emotional life, no anxiety or depression, or if we do have anxiety or depression, it's well managed. We've sought treatment if that's what's needed, and we're able to live with that. No chronic sadness, fear, anger, etc. We might have it at time, but when it becomes chronic, it becomes the defining part of our life. That's perhaps when we need to start looking at what we need to do to help ourselves. In terms of social wellness, strong community support, appropriate roles and relationships in our personal professional life, no excessive financial or other types of burdens, that we're able to manage those things. They don't become a burden. And then again, if these things become burdensome, that's when we start seeking help. Or if we're really isolated, that's when we start seeking help. And then some of the spiritual, we've seen this in that word cloud, many of these words, but meaning, purpose, sense of dignity about who we are, hope. Hope is a very tough concept for people because we often think of hope, for example, I have hope in that the vaccine will work, or I have hope that the meeting will occur in September in person. That may or may not happen. And so if it doesn't happen, what is our hope at a deeper level? Is there some hope that transcends things that are not in our control? And that's tough for me, I'll tell you, tough for a lot of people. Faith, community, connection, love, forgiveness, peace. So a chart I was going to share with you as well is some work that we've done around spiritual distress, and this is part of our ISPEC course, but many people have done research on spiritual needs, both in this country and in other countries. And some of the main categories that have come out of it are connection, peace, meaning and purpose, and transcendence. And so I described within the connection what is found in the literature and some of our work, what are some of those spiritual strengths? And one can think of these as ways to have spiritual wellness or health, if you will. So the ability to love, a belonging, connection to others, or to the significant or sacred, as our definition would suggest. And then to the right are those types of things in this category that would lead to spiritual distress. So grief, loss, bereavement, isolation, disconnection from the significant and sacred, etc. In terms of peace, seeking inner peace, an ability to forgive or to be forgiven, hopefulness, as we discussed, acceptance, humility. And then on the other side is guilt or shame, despair, need for forgiveness, lack of peace, lack of inner peace, hopelessness, need for reconciliation. Meaning and purpose is seeking meaning. It's an ongoing journey in our lives, acceptance and a sense of fulfillment. And then on the distress side is meaninglessness, spiritual struggle, existential struggle, that why me question, and getting bogged in that, down in that why me question. Transcendence, that strengthening of it, our personal faith or spiritual beliefs, however you describe that for yourself. Communication with, some people describe a higher being or the other, or maybe it's an internal communication to your inner self. Inner harmony with whatever belief system we have, spiritual practices such as meditation, it may be prayer for some, a desire to deepen a relationship with that transcendent. Again, that can be another or God, or a philosophy that we might have about what is greater than ourselves. The distress might be that loss of faith or questioning faith, an inability to feel that other's presence, or for those that believe God's presence. Conflicted or challenged belief systems, unable to engage the current practices, unable to deepen our spiritual relationship. And then just to put one slide up on distress, even though we're talking about wellness, is that actually there are a lot of studies that spiritual distress is associated with poorer health outcomes. So this is a huge argument for addressing this in clinical setting. We can, oftentimes I've seen patients who have unrelenting pain that's not being managed by all the medications I give them. And when I dig deeper, maybe it's psychological distress, depression, anxiety, or social isolation, or spiritual distress. So it's really, really key that this element of spiritual distress is addressed in healthcare, as we are doing at GWish, but also in ourselves. If you start feeling that, when you have physical pain, you reach out to someone for help. And if you start feeling that distress internally, existential or spiritual, it is time to seek help. Either talking to a friend, seeking professional help, talking to your physicians, nurses, talking to professional chaplains or spiritual directors, spiritual counselors, etc. So the spiritual journey can be thought of as an evolution of meaning. And we might have meaning in relationships, we might have meaning in our activities, in our profession, in our work life, many ways that we find meaning. Eventually, though, we probably, as we get older or we're moving closer to end of life, is that transcendent meaning, that position to a deeper sense of who we are, an awareness of that inherent value, not just of ourselves, but of everybody. I'll talk about an area of Gerotranscendence in a minute, where it's that very beautiful view that everybody matters. If we all had this, we wouldn't have the kind of problems in the world that we had if we could be at that level. Just acceptance, total acceptance of others and love, an understanding of what gives ultimate meaning, value, and purpose in life, independent of the externals of our life. Kathleen Dowling Singh wrote a beautiful book called Grace in Dying. And in it, she talks about what I term spiritual growth, but I think it's a beautiful description. And she says, in dying, we move from chaos to surrender to eventual transcendence. The initial encounter with illness and the prospect of dying can result in chaos. Surrender is when one is open to one's deeper being. Transcendence is going deeper within ourselves, into spiritual integration. So that is what I think is a beautiful description of growth. It doesn't happen overnight, and it's very, very difficult to move from that stage. And, as with any other stage, we move back and forth. So certainly, when people have been challenged with COVID, to move into surrender, after that initial encounter is very, very difficult. And it's hard. It's an individual process that people eventually get to that point of saying, I need to accept this. Now what I do. And then as we go deeper into ourselves, we get a deeper understanding of who we are, and perhaps even a sense of peace about things. So Eric Casal, medical ethicist, has written a beautiful, beautiful description of transcendence. He says it's probably the most powerful way in which one is restored to wholeness. When experienced, transcendence locates the person in a far larger landscape. The sufferer is not isolated by pain, but is brought closer to a transpersonal source of meaning and to a human community that shares those meanings. Such an experience need not involve religion in any formal sense. However, in its transpersonal dimension, it is deeply spiritual. And I share this quote a lot, and each time something new strikes me, and this time it's the human community that shares our meanings. It doesn't mean that the community shares exactly what is meaningful to us or what is our deep meaning, but that sense of the search for meaning and being able to share that, and being able to share that not just in our local human community, but thinking about the people that we have difficulty with. They're part of our human community, the people all over the world. I do Headspace. I really like that app, and I appreciate having that as a way and a reminder for me to do my own meditation. But one of the instructions is to focus on your breath, and then become aware of the love of within your life, and then think about bringing that love and compassion to people around you. And now broaden that circle. What about the people in your work? What about the people in your city? What about the people in your state, in your country, in the world? And how that sense of connectedness that we can feel in this community. Now, exploring these deep questions that get triggered by all those things from a few slides ago, illness, pandemic, war, etc. I mean, these are huge, huge events that can happen in our life. And it's the sort of the box in the middle is each of us that gets struck by these events and then have a response. And we may have a response that ends up in depression. We may have a response that ends up in spiritual distress. We may be sad and angry, and have some spiritual questioning, but we can resolve it on our own. And then perhaps sometimes we may grow from that experience. So the it's a discernment process often when we get stuck in that space. And if we're so stuck that it leads to distress, that's when we need help. And if we have the resources around us that we can move perhaps into growth, so that may happen for us, but that's not a trajectory for everyone. These things are very, very tough in people's lives. And, meaning in the midst of suffering, the meaning of life may change. Anytime we encounter these challenges, we change at a very deep level. People talk about the new normal being different. Well, we change. There's always a new normal for us because all our life we're encountered with things. They may not be this common as COVID now is around the world, but we all experience things that profoundly change us. So hopefully there's always a new internal normal, if not a new external normal for us throughout our life. So not always does suffering lead to meaning, though. I don't aspire to the belief that, you suffer and that's good for the soul. I do not know, no religion actually says that. People interpret it that way. But so I'm not saying that, this is good for you and you're going to find meaning. But if we are struck with suffering, maybe something different might happen for us. That new normal continues in our life. So these are stages of spiritual and or faith development from Fowler and Levin. And not necessarily to go through it all, but just to say that there is a lot of literature in how our spiritual life evolves. And preschool children, often it's fantasy and sort of basic ideas about the transcendent or God or others picked up from parents. Then the mythic literal is the school age and starting to understand the world a little differently. Teenagers are in stage 3, and then sort of life has grown. They're in these social circles. They want to pull it together, but it's not so easy to see outside the box until stage 4, which is a tough stage. It's young adulthood, and people start seeing outside the box and realizing that there are other boxes. So that's the critical examination of our beliefs on our own. And maybe we become disillusioned with what we've learned. Maybe there's a sense of emptiness, but it's a real active time. And then midlife, stage 5 is usually midlife. We start realizing the limits of logic and start to accept paradoxes more easily. And then stage 6, they say few people reach this stage, but imagine if we could, that those who live their lives in full service of others without any real worries or doubts. That's an amazing stage to aspire to. And just like with any other stages, I think we move back and forth as well. So Gerotranscendence caught my attention a few years ago. Building on this work, scientists in Belgium proposed a stage called Gerotranscendence for the aging person or younger people facing more the last part of their life. And looking at a shift from a materialistic and irrational one to more of a transcendent, a whole kind of vision stage. And so what are the key issues here that we need to be concerned about for people in this last stage? What are some of the issues that we can think about when we start reaching that latter part of our life, and for people who are facing their end of life? Are we giving people the opportunity to experience transcendent connection, having time for contemplation and solitude? Or is there just such a focus? I'm accompanying several people now who are different ages, but at the end of life, and there's such a focus on treatment choices, resuscitate, do not resuscitate, chemo, no chemo, that there's little room for this. And to try to say this is just as valid as the chemotherapy and everything else is to focus on this part of our lives as well. So the studies are really interesting. They've developed a scale in Gerotranscendence, and there's a transcendent view, this connection with the transcendent. And that's got a lot of positive correlation with inner peace, et cetera. And then anxiety and uncertainty. Death anxiety is lower in people with strong spiritual and or religious beliefs. And this last one is the one that always fascinates me, having seen patients in nursing homes, is that there is this increased need for solitude, rejoicing in small events, what's often called modern asceticism. And yet, interestingly, in studies, these behaviors were seen as negative by nursing home staff. So what do we do with our patients? We think it's good to have them go to the bingo group or to this group, but maybe they need solitude. And the challenge is to distinguish, is this a healthy spiritual health solitude, or is it depression or spiritual distress? But I think it's something that I often reflect on, and certainly have witnessed in my father as he approached his end of life. Was a very outgoing, extroverted man who I saw needed more of that quiet period. And I see that in my patients as well. So I think something to reflect on is our source of meaning. What matters most? What's the place of suffering and healing in our lives? Is my spirituality connected to my well-being or not? Do I think of it in that way? How is it? And is there something I need to do, change, or pursue differently right now in my life? I also want to talk a little bit about the concepts of call and vocation. What is our purpose in our life? How do we find meaning in our work, in our profession? Does it challenge for those of us that are working? Is it still challenging us to grow spiritually? And then is it just a job, or is it a vocation or a deep calling? Are we accessing passion with our work? Does it bring us joy? Does it energize us? And for those of us, and this is something I often think about when people say, am I going to retire? I think, oh, I hope not. I love what I'm doing, but it happens to everybody. What about retirement? Where does all this passion that we've had all our life, our call, our vocation, where does that go in our latter years in life? And I don't have an answer, but it is something to reflect on. And I will share a few lessons learned in my life that might help us in that area. So here are the spiritual tasks, I think, in aging, and I call that also known as lessons learned from my dad. So some of you may know that my father moved here when he was 90 years old from California, and a lot of changes for him. And I was privileged to be able to take care of him, and he died last March, right before the shutdown. I always say, thank you, Dad, perfect timing, or I would have been crawling up the building that he lived in, even though they locked all the doors to families. So I'm happy I didn't have to do that. But it was an amazing journey with him, and I learned so much all my life, and in particular, these last almost 10 years with him. So is there a new meaning? Has our meaning evolved to a new place, a new purpose? Is it a time of letting go? My dad worked his last day of working as a reserve officer with the LAPD. That's what he did in his older years. He did other things in his younger years that he had to let go of that. He also was an opera singer, so fortunately he didn't need too much to let go of that. He could continue singing up until 3 days before he died, but lots of things he had to let go of, and that's tough. It's tough letting go of stuff. Are there add-ons though? For the things we let go of, there's an opening to space for other things. So are there add-ons, and what are those add-ons for us? Is this a time of legacy building, a time of being remembered and thinking how we want to be remembered? And is there something we want to leave behind to the people that we know, family, students, others? And what do we need to do about that? Or is it simply who we are and the example of who we are as we age, as my dad was? Are there new sources of love and awe? I mean, that's an amazing thing. And then is mystery less challenging, an opportunity for deeper inner exploration? I remember before my mother died, I asked her if she believed in God and what that was for her. And she goes, I don't really know anything for sure. All I know is I believe that whatever happens after my dying is just going to be a really fun journey. And I just remember thinking, what, humility and honesty to be able to let go of all those kind of beliefs we hold on to and just be open to mystery, really. And then transcendence and hope. What does that look like in the final years of our life? So my dad was a fantastic example. And when he moved here, he was a widower. My mother died about 7 years before he moved here. When he moved here, within 3 months, he had a girlfriend. And this is a picture I took of Mary and my dad many, many years ago. And I put that in a frame for him, which he kept in his condo unit. But they had an amazing relationship. And I remember we went to dinner with them at Fort Myer. Mary belonged there. And everybody was dancing. And, here they are with their canes and walkers and their various issues that in arthritis and other things that go on. And that music started, the canes stayed at the table, and out they went on the dance floor. And it was just fantastic to see them have joy, to see them have joy in each other, to watch over the years how they, cared for each other, and it's just so hopeful to see how people can continue to live and find new areas of love, joy, and meaning. That was phenomenal. That was a phenomenal time. And then, you know, as my dad got older and started, he fell and he was in a wheelchair, I thought, for sure, this is it. I said, this is it. You know, I told my dad's aides, he's not going to stand this, you know, and many people, you know, after they have that kind of injury and when at his age at that time, sometimes just stop eating or they're not, you know, interested. No, not my dad. He figured out a way to deal with it. He was angry and he didn't like it at first, but he dealt with it and continued and actually used it to get himself earlier in line for the dining room and all sorts of things that he managed to put positive spin on. So again, can we do that? And, you know, that takes a lot of strength to be able to do that. And then, you know, when about 7 months before he died, he started losing a little weight and we had a talk. And I remember sitting with him at the bedside at one point and saying, Dad, I think I know what's happening. You know, I think it's time. He goes, yes, it's time. And I'm ready. I'm ready. And what a gift for me to hear that and to be able to accompany him to his final last breath. And know that for him and his belief system, you know, all his life, he said the most important thing was to be able to be with God. And I remember Ed and I were talking and we said, can you imagine his face when he sees God? And then I said, yeah, and can you imagine God's face when he sees my dad? And that's the kind of conversations that we had. It was, again, precious gifts to me, precious, precious gifts. So how can we cultivate a spiritual perspective? I think that's part of this journey in spiritual development. So what is that about? Maybe an awareness of the sacredness of our existence, of the existence of the world around us, of what our place is in this universe. The miracle of life, perhaps acceptance, as my dad did, of dying, cultivating appreciation, gratitude, wonder. Maybe a positive reframing, you know, trying to reduce that negative labeling. Maybe it's gratitude. And I think gratitude is so, so, so important. Brother David Stendhal-Rost and I have a video that it's going to be shared in the chat box because it's a little hard. It's 5 minutes and it doesn't always show well. It's not this video, although I'm happy to put that on as well as another one that he did about gratitude. But Brother David Stendhal-Rost was a psychologist, came to this country, entered a Benedictine order, and then his abbot told him, you need to go out. You need to learn from Eastern tradition and other traditions. And so he ensconced himself in Buddhism and Hinduism and other traditions. And he's one of our world's spiritual leaders. He has an incredible way of speaking about spirituality in a way that everybody can understand it. And this was a talk that he gave on stop, look, and go. And people asked him about, you know, what is a spiritual practice? What do I need to do? Who do I need to learn from? How do I find an hour a day to meditate? And he goes on to say, it's not the time. It's this, it can be brief. So you stop in the moment, in the now, a pause in the busyness of our life. You look, you reflect in that present moment. Who am I now? Am I being authentic or am I acting out of some insecurity? Am I aware of who I am? What is there now in the present moment around me? Am I living my life now in a way that is in harmony with who I am authentically or not? Can I appreciate the gifts of the moment right now? And then once we have that reflective moment, we then continue with our journey. So it's like, you know, you come to the stoplight, you look, and you continue going. And that was his analogy. And it's each of us have to find our own way for doing this kind of practice. But the general recommendations is that they should be regular, which is why I found Headspace helpful. And my dad actually taught me how to meditate when I think before I was able to walk, actually. He was talking about meditation and he was interested in so many different traditions. So he taught me all the different types of meditations as I grew up. But I don't think I ever really had it for a sustained regular practice. And just having that Headspace for me helped me with that. There's also a Calm app if you're into apps and other things as well, but regular daily practice. Mindfulness is such a popular thing now, and I think it's a way of a non-judgmental awareness of ourselves and a way of regulating our emotions and how we perhaps get lost in anxiety and worrisomeness. A use of rituals, whether personal or communal, can be very helpful. and how we might incorporate that into our life. There's a wonderful tree of contemplative practices, and if I don't think I have a copy of it, but I'm happy to share it if people want to email that to me. But if you look at that tree, there's many different aspects. There's sort of the ritual cyclical, and people can establish their own rituals. There's movement, the labyrinth, taekwondo, qigong, other types of movements, movement practices, walking meditation. There's the relational aspects. There's activism, so working, volunteering, bearing witness, pilgrimages. There's a creative aspect, and contemplative arts was put there. And this is from contemplativemind.org. You could also find it there. Music, singing, journaling, and then more generative, like the Lectio Divina practice, or visualization, or beholding out of Buddhism. Lectio is more out of the Christian practice and other types of practices. Beholding is more a little bit from the Buddhist practice. Loving kindness meditation also from Buddhism. And then stillness, meditation, quieting the mind, silence, centering. Those are all potential areas that might be a place for you if you haven't looked in these areas. And then I just want to share we took the FICA spiritual history tool and created a self-assessment tool around the same time. And it's, maybe this would be helpful to you, maybe not, but it's reflecting on, am I a spiritual person? Do I have beliefs that help me cope with what I'm going through right now, or with my illness, and what gives my life meaning? And again, these spirituality evolves through life. So hopefully our answers over our lifetime are changing as we reflect on this. Importance, is it important to me? Does it influence me how I think about my health, my decisions? Do I belong to a community? It could be the traditional one people think of, like church, temple, mosque, or it might be family, friends, the yoga group, people I hike with, people I love, and am I happy there? Do I need to do more to find a community? Do I need to search for another community? What do I need? And then an action plan. I think that's really helpful, and about what are the changes that I need to make. And some of the people that are helpful along this journey are spiritual companions. There may be spiritual companions in your life, people that you work with, or other people that you are in a group with, a spiritual companion. There may be a chaplain would be helpful, or a spiritual care professional, or a spiritual director, or pastoral counselor. But there are many sort of guides that people have found in their life. And it's often helpful to have that, because we get a little solipsistic about our own journey. It's good to have a perspective from another. So that's the link to the video. And it is, again, from Brother David Stendhal Ross, and it's on gratitude. And it's a beautiful video that he produced in a way to help raise our awareness about the things in our life for which we can have gratitude. I've used it in the retreats that I've led. I've used it with medical students and with others, and it's very, very broad, and people can have that, can find your own place in it. He also has images from around the world and people from around the world, and has a very wise sort of view about gratitude practice and gratitude self. And then he introduces this notion of blessing, being a blessing to others, and welcoming the blessing of others and nature and beauty into our lives. So I want to sort of close with thinking about blessing. How were we a blessing today to ourselves, to other people? Did we experience awe, wonder, mystery? Did we make time for that? And what difference did we make in the lives of others today? And just to close with an image of my dad, who really was an incredible, and continues to be an incredible blessing in my life and the life of others, a person who was able to continue his call and vocation to the end of his life, because his call and vocation was to serve others and to be present to others. And he continued that. And he had different faces for that. And, when he was in his 30s, his work was an expression of that. And then in his 90s, it was in the relationships, in the way he treated me and my family and everybody around him. And so SAR was one of his aides. And what he said is, at the end of the day, he blesses me. There is nothing more holy than that. So I would like to just close with that, and thank you so much for your attention, and I look forward to any questions and dialogue. And at the end of the presentation, and again, this is also on our website, we have a lot of information and resources for you. Thank you for your attention.
Wow, that was really good. Let's see. We do have some questions. Let's see. It looks like Janet has her hand raised. So I'm going to click on the button to allow her to talk. But while I do that, I'm going to read the question from Mary Jo Deering. So Mary Jo Deering asks, healthcare professionals and hospitals are so overwhelmed by the sheer volume of COVID patients that they are horribly rushed and stressed. Do you know of any hospitals that have been able to integrate your good spiritual care principles into these dire situations? Are any of them reaching out to GWU, do you call it GWish, or vice versa? Yeah.
Great question, Mary Jo. It's nice to see you, or at least hear from you. So actually, COVID, as I mentioned, has really raised people's awareness to the spiritual domain. And many of my colleagues at GW around the country and around the world have shared that. And we had a virtual or a CC retreat this past year was virtual. And they've shared how, while they can't do very much for people with COVID in terms of physically for them, there's sort of a limited amount, especially at the beginning of the pandemic, there was this increased awareness of the importance of being present. And so actually there's been a lot of my colleagues here and in other places that are recognizing the importance of being present and recognizing the value of the, quote, just sitting at the bedside, especially in the lives of their patients. Here our division was able to increase the hours of a chaplain so that chaplain can be there to support our staff, particularly at the hospital in particular, but outpatient too, in palliative care and geriatrics, and be there and be present to the staff as they're dealing with the huge volume of patients and also the spiritual distress of their patients as their own. And many places around the country, those people that have done our ISPEC training are certainly integrating much of this work. And we also presented the model as a brief. And if Steve or Lori, if you remind me, I'll add that to what I can email to people. We did a brief for global organizations in palliative care on spiritual care in palliative care during COVID. And we've had beautiful response to that. I actually accepted an article that was published in a section of Journal of Pain and Symptom Management that I co-edit on humanities, language, art, and spirituality. And it was the journey of a chaplain caring for a COVID patient and how she was struggling with her own fears of getting the virus and trying to understand as she called it, the PPE extravaganza, and how to be present through that, through the shield, through the masks, and some incredible sharing and stories of that. Thank you for that question. Great,
great. And it looks like Janet inadvertently raised her hand, but I would say to the rest of the folks in the audience, let's see, Mary Jo, whoops. Whenever I say raise your hand, then somebody will raise it. But let's see, Mary Jo, did you want to say something? I am unmuting you. So what I would say is that folks, Mary Jo?
Yes, well, I don't want to monopolize it, but since nobody was jumping in and Christina is so wonderful, so I obviously have the privilege of having Christina as my primary care doctor. For those on the call who don't have a doctor like you, what can they do to help either find one like you, or if they like their doctor otherwise and the doctor is really very caring, what can they do to help introduce their care providers to your principles?
The first thing is to talk about your spirituality, just say, this is a part of my life. I really want to share it with you. And I think that's really huge. And then if you have the kind of suffering that is not easily put into words, tell that to your doctor or your care provider, and that you want some additional help. Also, please, visit our website and sign up. We are trying to develop sort of as many stories as we can to continue to advocate for these programs in clinical settings. And I think our board chair is on the call, Chris Kelly Simcoe, who is developing stories, keeping a catalog of stories of patients about what they experience and what they want different, because that's how change is going to happen. If you think about any of the movements at all in healthcare, you know, in the day when it was a paternalistic model, literally a paternalistic model, it was, you know, patients saying, we don't want this anymore. We want to have a say in our healthcare. And so I think we need to think about developing greater advocacy and spreading the stories, and happy to have any of you reach out to us and work with us. I would be really grateful for that.
Great. Thank you for that, Mary Jo. And let's see, Kara asks, what type of activities can nursing homes offer residents to help address their spiritual needs?
So great question. So for our ISPEC training, we actually did have some of our sites. We've now had the ISPEC course was started in 2018, and we've held courses 2 a year since then. This past year it was a virtual one, and several of our sites were from nursing home settings. So a couple of ways to answer that. One is to train, and what the nursing home sites did is to train their CNAs and their nurses and the physicians and nurse practitioners and others in how to ask patients about their spirituality during the spiritual history or screening. And so that's been one change. And then the other, and I think this is so crucial, I have mentioned chaplains a million times, I think, in this talk, and certainly in all the talks that I've given. There are nursing homes that have board certified chaplains and other spiritual care professionals who have led support groups, who've been able to visit the patients. And I think that that is so critical. So I would strongly advocate for anybody who here is with nursing home settings that we think about how we can increase the representation of spiritual care specialists at nursing home settings. And it can be done in various ways. Many of the settings I know have a full-time and some have a part-time. So I think that's important. The other is some of the resources I've shared about meditation and that tree of practices. So, you know, think about how we can bring teachers in for that. And with regard to Gerotranscendence, are there opportunities for people to meditate or to have solitude or contemplation? Are there physical opportunities to insert beauty? Are there little gardens or places where someone can go and just sit by the tree? I know where my dad was at the Jefferson, it's a great place. In their rehab unit, they had a very big cage with parakeets, and people used to just come and listen to the parakeets, and they tried to integrate beauty as much as possible into the setting.
Those are great suggestions there. All right, well, this has been fantastic. I'm gonna make a last call for any questions or comments. And Christina, I'm hoping that, because there's been a lot of requests for your PowerPoint, would it be possible to share those with us and we could email them to the attendees?
Yes.
Okay, great. So we'll do a follow-up with the recording, so you could share the recording with your friends, and if they were unable to make it, and then we'll also include the PowerPoint along with that. Let's see. Well, no one seems to be raising their hand, so I think everybody must be ready to practice some of the spirituality that you talked about and watch that wonderful video, which I shared with folks. Let me bring Lori on to thank her for bringing you to the audience, and maybe just say a few closing words here. I knew this was going to happen. While we're waiting for Lori to turn her camera on, Martha Cooper asked, what are elements of self-care for providers and chaplains?
So I can briefly say some of the work that Jim Blatt, I mentioned Dr. Blatt and myself did with reflection rounds. And what we're finding is that we're often on this kind of treadmill and moving very quickly. And what we need is that same type of, well, an opportunity to sit together with each other and share about how we've been impacted by our patients. And the reflection rounds, which we are probably going to be doing virtually. If you're interested, again, let me know through our website, or I might just type in my email. I'm very happy for you all to email me too. And there's my email. So in the reflection rounds, it's a contemplative type of facilitation, not a group sharing. And there's Jim, there's Dr. Blatt right there. And I really want to thank Jim for his ongoing collaboration for years in all of this work. But people are able to reflect about a story of a patient that they recently cared for, and how were they affected by that in many different ways, emotionally, spiritually, humanistically, and other ways. And I think that type of sharing really, really helps clinicians. The other is to everything I've shared in this presentation applies to the rest of us who are clinicians as well, as caregivers, as aides, et cetera, is what have we, all those things. What is that FICA for ourselves? You know, what are we doing a spiritual practice? If so, is it on a regular basis? You know, how are we able to understand what's happening to us in the stress right now in caring for patients who are seriously ill, who are suffering? How do we take care of our inner self? What opportunities do we give ourselves for contemplative practices or other types of practices such as mindfulness?
Great. Well, this has been wonderful. And Lori, thank you, and Villages of Kensington for bringing us Christina and her presentation. And with any sort of closing words there, Lori?
No, it's just been my privilege. And as I said, I'm delighted that we have had a wonderful audience. And I'm just really, really pleased that Christina managed to finally come. And it's wonderful, just wonderful. Thank you very, very much.
Thank you, Lori. And thank you for having me. It really was a pleasure.
Great. All right. Have a good evening, everybody.
Take care.